it's conflictual or conflict of interest. The two pre-test questions that I'd like to present to you first will be the Joint Commission's Speak Up on Antibiotics campaign is aimed at hospital CEOs, patients and their advocates, physicians, or the pharmaceutical industry. And question number two, and use a pencil for this one because you may change your answer as we proceed. The Joint Commission's antimicrobial stewardship standard is under development or approval for upcoming implementation. As my predecessor who spoke before me mentioned how this is unraveled with antimicrobial stewardship and resistance posing a major threat to public health and safety, I want to also impart and make sure that we're all on the same page, that we all represent organizations, healthcare entities, but we're also patients, and we also have loved ones and consumers that also, with many of the comments that the audience has mentioned up to this point, that we play a major role outside of our four walls in our healthcare settings to help drive antimicrobial stewardship. And this is a global effort. In addition to what CDC has stated as approximate targets of illnesses impacting 2 million in deaths being 23,000 in number, that when you look at the WHO article report in 2014, we still have this mindset that this is happening in the future, that this is coming. This has been here for a number of years, and we have just in the past couple of years put this at the forefront. So again, this mindset needs to be, it's not just at work. This happens when we go traveling. This is global. This is international. And if we all aren't on the same page, it's not going to help. If we're just looking at our ambulatory care setting, our hospital, it's not going to do what we need to do across the board. So again, as Dr. Tavetti mentioned, we had a rollout that really started to focus on this. We had governmental support. President Obama made this a huge issue in 2014, developed a task force. We had the National Action Plan, CARB, in 2015, combating antibiotic-resistant bacteria. And in 2015, we were, Joint Commission, one of the 150 healthcare organizations that is committed to this effort. So what unraveled in our four doors at the Joint Commission, let me preface this by saying we, as the Joint Commission, are the oldest accreditors and the largest, and we accredit over 21,000, and if you look at the website, it changes from year to year, but approximately 21,000 health organizations, and about 1,000 here in the state of Illinois. When we took this to task at the Joint Commission, we looked at where our standards and elements of performance and national patient safety goals were currently at. And we do not make decisions unilaterally without touching bases and working with our key stakeholders. This involves many of you in this room, and it also involved many professional organizations, federal included. Currently, and I'm not going to belabor, I know many of you probably brought your Joint Commission accreditation manuals, you can put those aside. We have standards that support antimicrobial stewardship, but they don't specify this to the level of detail that organizations are going to need to perform and conduct and get an antimicrobial stewardship program up and running. And obviously they would be well suited, and many of these elements are incorporated in what you've seen with what we're going to be promoting in the new year 2017. And they include leadership, they include medication management, they include infection prevention and control, and our performance improvement with data, looking at data, analyzing it, making continual improvements, and multi-drug resistant organisms that play a heavy role with the impact on misuse and overuse of antimicrobials. So what took place at the end of last year in November and December of last year, was a field review. And this included many of the key stakeholders that are involved in antimicrobial stewardship: hospitals, critical access hospitals, ambulatory settings, office-based surgery practice settings, and nursing care centers, otherwise termed long-term care. And what unfolded with this is very supportive, no surprises to anyone, I'm sure, that this is supported in our evidence as the right way to go. It is a patient safety issue that we need to address, and that the ambulatory care setting, although it's vitally needed, and we have well known that the use and misuse of antimicrobials in the outpatient setting is critical just as much as in the hospital settings, but that would be supported in a phased-in approach. So if I need to pause here to anybody who's going to change that answer on the pretest, now's a good time to make a note. The antimicrobial stewardship standard that was now placed in our Perspectives newsletter this month states that critical access hospitals, and long-term care, otherwise known as NCCs, will go into effect January 2017. And we are still looking, as I mentioned, ongoing development and discussion with the ambulatory piece. Okay, so that's more to come. So that is still in development and in discussion. Educational efforts. This isn't just one-sided, looking at the professionals within healthcare that are going to be implementing this from a staff, licensed independent practitioner approach, but also to our consumers, meaning patients and their advocates. One of the educational efforts that we took part in about 2 months ago was in San Antonio, Texas. And we did, through our Joint Commission's resources, actually went into a hospital, spent the day with them learning about their antimicrobial stewardship program. And there are various case studies. You saw the wealth of resources that was already presented, that's in your packets and what you'll have for the rest of today. It is not necessary to reinvent the wheel. There is a wealth of resources. If you look at the professional organizations that are vested in this effort, many have case studies. It's done in many different ways, and we're all on this spectrum at different stages and ages with our antimicrobial stewardship programs within our organizations. So we have a lot to learn from each other. So that's how I looked upon it when I was down there. And it was very interesting to see the efforts of what infection prevention and control plays. Some have it very high, very integral. Some it's more supportive. Some have, based on resources, the ability to integrate an infectious disease pharmacist. Some may not. So there's a lot of lessons learned on what resources you'll have to help support your efforts. And what was nice about this, on the second day, we got to show the film clips to our audience and have them participate in questions and answers. So if you haven't had an opportunity to take a look at this, it's not very long, and it's in bits and pieces to show your colleagues, or just to take home maybe something that you want to integrate or hadn't thought about. The other piece, the Speak Up campaign, and this is not just for antimicrobial stewardship within the Joint Commission. Speak Up campaign started in 2002, and we now have over 40 countries that download the Speak Up campaign materials, whether it be an animated video, infographic. I was, for another project, on a phone with an organization. They said, "Lisa, these are millennials. They have short attention spans. You got to do something shorter and sweeter. We don't want to read a lot of papers." And I said, you know, this guy probably is spot on about this. And I think that the Speak Up campaign has been very successful because they're short and sweet. A lot of other professional organizations also have resources that have become very visual, just nail the topics, and it's not a lot of cumbersome reading. So the information on antibiotics, the Speak Up campaign within the Joint Commission has gone that route as well. And it is for advocates and patients and their advocates. That is the intent of this material. So now that you'll get 100% on the quiz as to the Joint Commission Speak Up campaign, and I don't know, maybe I misinterpreted the instructions, but I gave the answers at the end. And this, obviously, I hope everybody's got the answer to that. The Speak Up campaign acronym is very important to all of us, not just as healthcare providers, what this is trying to get across to patients and consumers, but I think there's a real need, and I think one of the audience participants spoke very well to this, is that we have a lot of work to do with the impression a patient comes in to a provider to see, whether it's inpatient or ambulatory, outpatient, urgent care, what have you, as to their knowledge base and expectations up front, and how if they are particularly, I don't want to necessarily say aggressive, but they can speak up for themselves and know what they need to discuss and can question and have a quality conversation. And I think that if we've learned anything, I don't know about you, but I always say to my parents, don't go in alone. Always go with somebody to have that extra eyes and ears to help with the discussion, or make a list before you go in to have, because all of it goes out the window when you're trying to remember, oh yeah, what I forgot to ask them this. That we don't have enough coming from the actual patient, client, consumer to support where we want to be with antimicrobial stewardship. I think we need a lot more emphasis and focus to help bring that up with education and that ability to open that door. And we're seeing with the literature, I don't know about you, but what I've been seeing is we still have a lot of mindsets from patients coming in that I'm getting an antibiotic, and they're not making that connection. So I think we do have an opportunity to make some room for improvement on knowing this and speaking more to this. And it's true, it takes more time. But again, it's the same thing if you're an infection preventionist. It takes a lot more time to prevent something, but it's worth it than having to go chase an actual infection or outbreak after the fact. And I think we're well past that with antimicrobial issues that we have now presented in our face. So again, looking at participation and equal dialogue, mutual respect going back and forth, and not slam dunking this with a quick prescription. We have the pros and cons, and we have people, again, across the spectrum. It does me well to see physicians talking that they do this, because it's very disheartening to hear the opposite side, where it's just easier to write a script or just do business as usual. And that's what we've seen. Joint Commission, this is the test question here, the kind of trick question, is under development approval for upcoming implementation. The answer is true. And why? You're going to say, Lisa, did you read your own Prescriptives newsletter? Yes, I did. We are going live with critical access hospitals and long-term care, or NCC programs, but ambulatory is still under development. More to come with that. That's not being written off. It just needs to be phased in and looked at in a separate light than the other 3 programs that are going to go into effect January 2017. And with that, I will take any questions specific to what I have just presented.